be a great news for you hearing that at least there's something that the president is likely to do to some of your dedicated staff who are there fighting for the country in the wake of a surge in COVID-19 cases. How's the Ghana Registered Nurses and Midwives Association receiving this announcement?
Right. Good afternoon to you and good afternoon to your viewers. Indeed, my heart is gladdened, but despite the fact that the president did not mention the category of people that will be given the awards, it stands to reason that majority of the awards will go to nurses and midwives, because if we talk about frontliners, our members were almost everywhere, and therefore they deservedly needs to be awarded. But I don't want to preempt the situation. I believe that the president knows exactly the category of health workers that he'll be awarded.
In fact, in terms of honoring healthcare workers, the president years back announced some packages, special packages for your members as part of a way of rewarding you for serving in the front line. How far are we some of these promises, and has the government, kept its words? The promises and some packages that were announced in terms of insurances against COVID-19. I recall the president announced some of these measures.
Well, exactly. I have no right to doubt the president. I have no reason to doubt the president, of course, the number one gentleman of the land. Previously, some few promises were made in respect to COVID allowances, insurance package for frontline health workers. Of course, some were fulfilled. For example, if you talk about the tax waivers that health workers were supposed to receive, almost every health worker received that tax waiver. Few things that's got to do with the insurance is still not being fulfilled, and we believe that the president will do what is necessary.
Help us understand that concern. What are some of the challenges with the insurance package that you were promised as a group?
When the pandemic broke out, we approached the leadership of the ministry, for that matter, the minister. And I remember my president informed the minister that there was a need to put in place an insurance package. So that was headed to an insurance package was announced for all health workers. It was in various stages. For instance, if you got infected in line of duty, you were entitled to a certain package. If you ended up at ICU, you were entitled to a certain amount. And then, unfortunately, if you died, your relatives or your next of kin were supposed to be given a certain amount of money. So they were graduated in that order. What I can say is that the payment has been very difficult. None of our members who died have received the insurance package. We have made several attempts to knock the doors of the ministry, and that has not happened. I believe that having heard the president going further to give some awards to deserving people, they'll get in their strides to fulfill them.
Do you have a sense of the numbers? Probably some of your members who were affected in the line of duty and some who ended up at the ICU, as you're pointing out.
We forwarded the statistics, the numbers some time ago, but about 840 of our members, as of 1st of August 2021, have been infected.
So this package has not been paid as far back as 2021.
Yes, as far as the insurance is concerned, I told you that there were various packages.
So which means that there may even be a pile-on effect. From August till date, that's a significant time frame where, I'm sure obviously more of your members got infected, and the numbers may shoot up from the 800 that you're pointing out to.
840, yes, definitely. By all means, and even the death. As of August 2021, we had lost about 6 people. I think at the end of the year, up to January 2022, we had lost about 9 nurses and midwives, if my memory serves me right. But my information is that none of their relatives have ever received any insurance package to that effect. Not only nurses and midwives, even doctors. I remember I have friends, colleagues who were doctors. I mean, I ever worked with some of them at Trust Hospital Hospital who lost their lives in the course of duty to COVID-19, but never received any insurance package. As for the insurance, it's a problem. I told you that there were several packages that were announced.
Right.
Okay, the insurance, the 50% for frontline health workers, and then the tax waiver. The tax waiver was 100%. Everybody got it. The 50%, quite a number of the people who were entitled, who were designated as frontline health workers, also received it. But few others brought some complaint that despite the fact that their facility sent their names, they never received that package. And then where my emphasis on is the insurance package, which was supposed to go to those who were infected in line of duty. And mind you, in line of duty, you could be infected, in the course of pursuance of anything.
But I recall but I recall that even at the time, aside the issue of the insurance, there were some issues with logistics and PPEs. Have these issues been
initially?
Right.
Initially, we had those challenges, and I remember I had a cost complaint on your network. But as time went on, the government was able to provide the necessary logistics that we needed to take care of our people. And if you remember, even locally, we started producing some PPEs, which we had to challenge the Food and Drug Board as to whether it could stand the test of time and it meets the WHO recommendations. But all in all, I believe that getting to the latter part of 2021, we had gotten enough logistics to be able to battle the disease.
So if you had an appeal to make to the president, what would that be?
Well, what I want to tell the president is that we are thankful for his goodwill towards health workers. And number two, we haven't finished fighting the pandemic. Don't forget that there are other outbreaks dealing with monkeypox. We are dealing with Maybach disease. These are very deadly diseases. They should make the necessary logistics available so that nurses and midwives can have a respite whilst fighting the disease. We are ever ready to help in the nation building. We are not going to renege on our responsibility at all as nurses and midwives. But what is necessary should be provided so that our people can have the right frame of mind to be able to deliver.
Are we likely to see an engagement between yourself and that of your employers, perhaps through the Ghana Health Service? Because even beyond the issue of the insurance package, the PP and others, you are equally alarmed at the cost of living allowances. We've exceeded the deadline, the 31st. We know for sure that that amount hasn't been paid. I remember still taking that in good faith.
My president sent a team, which I was privileged to have led, to the Ministry of...
Hello, David. Okay, so David would definitely join us back briefly just to wrap up on that point of on the cost of living allowances. Mind you, the GRNMA was part of the association that equally raised some concerns asking government to pay the cost of living allowances, just together with the teacher unions and the public services workers union as well. But then we do understand that there are some delays in the disbursement of that amount and MOU that was signed between the Ministry of Employment and Labour Relations and Organised Labour. You recall that almost all the groups, including TUC, had threatened to lay down their tools, but for the last intervention that we, of course, witnessed from the high-powered delegation from government. So there was an agreement to release the funding to all of these groups. He's giving us indications that that amount was not paid. But as to what the nurses and midwives should do going forward, it's something that we'll keep an eye on and obviously bring you some updates on. Let's see if we have David Tinkranchum back on. David, if you can hear me, I was just asking about that meeting that you're about speaking of, that you led a delegation to seek some clarity on that payment. Tell us more about it.
Yes, can you hear me now?
Yes, I can. Oh, too unfortunate there, but we'll definitely bring you some updates on that. Let's start.